Jan will be joining us any minute now. I have my own questions that I'm going to ask her, but everyone please feel free to just pop some questions in the chat because we will be happy to answer them. Sorry guys, I'm just looking at my computer really quick. Oh, it says Jan Marini Skin Research has joined. Wonder if we're just having my internet better not act up. Okay. All right, guys, we're just waiting. I'm just gonna look because I had my phone silenced so that calls wouldn't pop up while I was on my live. So I'm just checking that on my laptop. Okay, we're just kind of hanging out here. Let me pop off and come right back. Okay. Okay, sorry about that, guys. Oop. Okay. I set this all up and now I'm like messing with it. Okay. Okay, so I think we might just be having technical difficulties because it looks like the Jan Marini account's on here. Let me see if I can add. I just invited Jan to join. Okay.
We're saying no.
Hi. I'm so sorry.
Hi.
Hi, sorry about that, Jan. Okay.
Well,
You can hear
I'm
me. I can hear
happy. I'm so happy to be here.
Thank you so much for joining us. This is our third live together. I feel like by now everyone is super familiar with you and all your amazing products. And we're going to talk about discoloration.
Yes, we are. And I want to encourage everyone to please ask questions. It doesn't have to be just about discoloration, but I love to get questions. And, as much as time will permit, we'll answer everything.
Amazing. Thank you so much. We really appreciate you taking your time to do this with us. Okay, so I guess we'll just hop right into it. So why do you think there's so much focus on discoloration today?
Boy, I'll tell you, there is a lot of focus. There's huge interest in discoloration. And, the fact is, every single person on the face of the earth, if you've got skin, you're going to have some type of abnormal pigmentation by the age of 35, maybe younger, but at least by 35. And they've done surveys, they've been focus groups, and they show pictures of individuals to these groups that have lines and wrinkles and pictures that have discoloration. And the individuals with discoloration often get guessed as being older.
I believe that, yes. It does.
Yeah, and
it does
and
age
so
you.
it bothers people. It really bothers individuals, and to think that maybe the discoloration actually makes them look older than somebody with lines and wrinkles. And, you know, if you don't have obvious areas of contrasting pigment, you've got something called background pigment. Now, background pigment is where, if you look at pictures of people over the years, their skin isn't quite as crisp. It's not quite as bright and clear, but it's an overall kind of look where it looks slightly darker. So the best way that I can kind of give you an analogy is if you have an area of your body that at some point maybe you tanned, and even though you may not have tanned it now for 10 or 15 years, you look at it and it's slightly darker than the other areas.
Yeah.
That's dyschromia, or
Okay.
background pigment. So everyone is going to have to deal with this to one degree or another. And depending on your background, your ethnicity, and all of that, I mean, it can be different for different people. And of course, hormones can play a role as well. So that's one of the reasons why this is such a popular topic.
Yes. And I mean, personally, I regret this every day, but I used to go tanning a bunch. So I know how that goes. And I always tell my clients that I feel lucky that I even have skin now because of all the tanning that I used to do.
Now, did you do
Okay, so
tanning with tanning beds or the sun?
both.
Both. Okay.
Yeah. So that's gonna last a lifetime. Okay. So are there different types of discoloration?
Yeah, and you know, this actually, we have a question already. This is, I saw a derm who said I'm doomed. I need laser. So this is going to kind of help to answer that, because
Okay.
I don't think you're doomed. But so when we talk about pigment, people like to put names to it. I have melasma, I have chlasma, solar lentiginase, you know, whatever it is. And I always say, if we called it mango tango, if we gave it any name, but we could get rid of it, what would you care what it's called? So what it's called is not important, because it kind of all comes under the same category. Now, I'm going to greatly oversimplify this. This is a really complex subject, but I'm going to talk about 3 types of pigment.
Okay.
And there's a reason I'm talking about this, because people need to be realistic in what they can address and what they can't address. So the 3 types of pigment are epidermal, dermal, and mixed. Now, how do you know which one that is? Well, you look under a Woods lamp. You know what a Woods lamp is, right? Okay. If I have 2 spots of pigment on my face and they look exactly the same on the surface, under a Woods lamp, if one of them is epidermal, it's going to show up. If one of them is dermal, it kind of disappears. Now, why is that important to know? And by the way, the third one can be mixed, so it could be a combination of the 2. Most pigmentation is epidermal. If you have melasma, chlasma, solar lentiginase, whatever it is, it can be dermal or epidermal, or dermal and epidermal. But most is going to be epidermal. Now, here's why it's important. In order for you to have pigment in the first place, you have to have active tyrosinase. So active tyrosinase is what goes into the manufacture of pigment, just your normal skin tone. If you didn't have active tyrosinase, you would be an albino. Yeah. So you must have active tyrosinase. Now, if we're going to topically go after pigment, you have to interact with active tyrosinase, because what you want to do is you want to downregulate it. It's one of the things you want to do. It's only found in the epidermis.
Okay.
So let's just say somebody has dermal pigment. Well, let's say that I gave you a jar and I said, rub this on your tattoo. You'd go, oh my God, are you crazy? You're not going to get rid of my tattoo by rubbing this lotion on. Yeah. Well, it's the same thing with dermal pigmentation. Okay. Because you'd have to go after it with a laser. But again, most pigmentation is epidermal. Even people that I've known that have had epidermal and some dermal have been able to even it out to the point where they're very, very happy. Yeah. So to that person who is talking about that the doctor said they were doomed, then I would suggest, for example, get a hold of Amanda, because she's trained in this. And even if it was all dermal, which would be highly unusual, do doing what we're going to talk about today could make a huge difference. It certainly can't hurt anything.
Yeah.
And our physicians, our biggest marketplace is physicians. Our physicians who work with these lasers all the time, they're still going to put you on home care.
Yes.
Okay, they're still going to have you doing this at home because you have to manage it. You have to manage it every day. You know, a lot of times people say, oh yeah, I got some laser treatments and it got rid of it. And then they don't think they have to do anything else. I can't change your genetics. Lasers don't change your genetics. The sun doesn't suddenly fall out of the sky and go away. All the things that go into pigmentation, they don't disappear. So we have to manage it every single day. So anyway, that's just a little bit more, a little bit about pigmentation in general, so that we kind of understand realistically how it occurs. Now, one other thing I want to talk about. So when you go outside, and this depends on your genetics, your ethnicity, you know, your reactive nature to UV light. UV light stimulates active tyrosinase.
Yes.
That's how we get a tan. And you know, when we were teenagers and we tanned, it was all nice and even, right?
So even, yes.
Right. Okay. So today, if you were to tan, chances are it might not be even, or if you get the discoloration, it doesn't just come evenly your whole face, it comes in splotches, right? Okay. That's to do with the damage, but that is the interaction with active tyrosinase. Now, when you go out in the sun, just for a minute, you create a reaction that can last as long as 72 hours after you're indoors. So you have to protect your skin, but active tyrosinase is one of the biggest factors in sun exposure. So again, UV light, active tyrosinase. Now, it comes through the windshield of your car.
Yes.
And sometimes heat can also be a stimulating factor. Some people sit in a hot car and they pigment, or they work, let's say, around really hot ovens. It could be in a factory where they smelt iron, or it could be around bakeries. It will actually aggravate their discoloration. So those are all factors. So what we have to do is we have to downregulate these factors.
I actually have a lot of clients that love hot yoga, and then they also have pigment, and I'm like, you kind of have to pick one or the other.
So say that again. They like what?
They do hot yoga, but then they also have a lot of discoloration.
Sometimes
so I always tell them,
actually.
Yeah, I'm like, you have to choose which is more important, unfortunately.
Also, it's bad for rosacea.
Yeah.
It can be.
Yes.
It can be an inflammatory. I'm a big believer in yoga, but I'm not a believer in hot yoga for those reasons.
Yeah. I mean, I think yoga is amazing. Hot yoga takes it a little too far. Okay, so what would you say some of the primary causes, we've talked about the sun, obviously, would be primary causes of discoloration?
Okay. Well, first, because I think everybody's thinking about this, what are the solutions? So I put up all of these different factors and everything. You know, how do we address that?
Yes.
So I'm going to spend a little bit of time on that. Okay. So I always tell people, you know, you can do anything you want, but there is no exceptions, no negotiation, because there's certain things you've got to do, or you're just going to be spending a lot of money for no reason. Okay. So number one, it starts off with the skin care management system. Okay, that's the box set. 5 products. There's a cleanser, a sunscreen, 3 products in between. I'm so sorry. Let me tell you, don't worry. I have done this before in the middle of an interview where I can't stop coughing. It's okay. So what the skincare management system is going to do, one of the primary things it does is it's going to get that superficial discoloration, kind of, let's say, even it out rapidly, and in a way which you feel like in a very short period of time your skin looks brighter.
Yes.
It also looks a lot smoother. It also looks a lot more reflective. when you're reflecting light out this way, you don't see the discoloration the same way as when your skin is duller and you have acne and you have more of an aged appearance. The light reflects in and it intensifies everything. So your skin can look brighter and smoother right away. And one of the things that I hear constantly, I'm sure, Amanda, you hear it as well, is people are on the system just a day or two and they go, gee, is it my imagination? But my skin looks smoother. My pores look smaller already. My skin just looks brighter. Yeah. So it's very, very quick. So that's, again, what we see on the surface. And there's a lot of other technology in skincare management. Now, I want to touch on something for a moment, because the question that comes up all the time is, how can we all be on the same system and have different concerns?
That is a question.
Well, BioClear. Let's just take one product, BioClear. BioClear is glycolic acid, salicylic acid, and azelaic acid. Azelaic acid is sold by prescription for acne. It's sold by prescription for rosacea. It's also one of the best agents we've seen for the appearance of fine lines, for the appearance of just, the crepey texture, pore size, and it's a pigment lifting agent.
Amazing.
Then we have glycolic acid. Now, glycolic acid we could spend hours on, but I'm going to try to be a little brief on this. At the very simplest level, glycolic acid dissolves and dislodges the glue-like substance or cellular cement between cells, cause them to lift apart. It does this without being abrasive. Abrasives, like scrubs, can make your pigmentation worse because they're inflammatories. They don't know the difference between the living tissue and the dead tissue. So glycolic causes those cells to come apart. Yep. It's anti-inflammatory. It also stimulates the substances between your cells, mucopolysaccharides, ceramides, phospholipids, and hyaluronic acid. So it makes the skin a lot more moist naturally. And glycolic acid goes into the follicles. It has this tiny molecular weight. It's so small that it's used in certain topical prescription drug products as a delivery agent. When it gets into the follicle, it dissolves and dislodges the glue-like substance or cellular cement between cells. When those cells stick together in the follicle, that's the beginning of the acne process. Now, glycolic acid also stimulates your dermis, which is 80% collagen. It stimulates the dermis by about 33%. So what we want the stratum corneum, that's this layer out here that's dead. We want that to be very thin and very compact. It's a better barrier function. It looks better. It looks more like baby skin.
Yes.
So that thickens as we get older. And it doesn't have that same refined, young look. We want our dermis, though, to be really, really thick. So glycolic does both of those things. Thins and compacts the stratum corneum, thickens the dermis. So, okay, so that's number one. That's absolutely critical. And there's a lot of other technologies in the system for the appearance of aging and for all of the common skin concerns. The second part, again, this is really critical, is going to be luminant face lotion. So this is going to go after the factors that go into discoloration. Now, there's 4 different areas of technology. And what I want to tell everyone before I start talking about the technology in this, that's really a game changer, is that the study on this was written up in the Journal of Drugs and Dermatology. That's a peer-reviewed medical journal that's highly respected, and it can take months or years to get into that journal. You don't see skincare products. You see cancer drugs and all kinds of other things. So this study that was in the Journal of Drugs and Dermatology is a half-face study comparing prescription hydroquinone with luminant facial lotion. Luminant facial lotion outdid prescription hydroquinone.
That's so incredible.
So there's 4 areas of technology. So the first area is that there are tyrosinase inhibitors. Remember, we have to downregulate active tyrosinase. There's a whole bunch of those that have been shown medically to be effective. The second area of technology is something that is a complete game changer. So we all have a melanocyte stimulating hormone. Now, you could have really fair skin, you could have really dark pigment, and we pretty much produce the same amount of this melanocyte stimulating hormone. However, it plays a role genetically in how you might react to the sun. Some people go out for 5 minutes, they pigment. Other people don't have the same propensity.
Yeah.
So for the first time, we have a peptide that downregulates the melanocyte stimulating hormone. And again, this is really a game changer. There's nothing like this. Now, the third area of technology is active tyrosinase. Excuse me, I'm sorry. Nope, turmeric. I'm sorry, I said that wrong. So it's turmeric. Now, we've all heard of turmeric. Some people take it internally. But they've used it for thousands of years in places like India, where when you put it on the skin, very rapidly, it has this lightening effect, but it turns the skin bright yellow.
Oh, wow. Yeah. You don't want to be walking around with that.
Exactly. And so what a lot of times what companies have done is they cut off pieces of the root or different aspects of it, but it lessens the effectiveness. So what we've been able to do is actually take the active chemical and make it colorless. It's anti-inflammatory, it's also anti-aging, and it is a tremendous tyrosinase inhibitor. And finally, we have a retinoid.
Yes.
Now, I'm going to spend a moment on the retinoid. I'm going to kind of unpack this. So retinoids are a gold standard for anti-aging, for discoloration, rosacea, for acne. And this is something that I think it should be a law that everyone has to use a retinoid.
I agree.
Now, I'm going to kind of go over how retinoids work and how they work for discoloration, aging, that type of thing. Okay. So it works different than glycolic. It does help initially to really help to kind of make the surface of the skin appear to be lighter and brighter and more even tone. But retinoids de-age the appearance of skin. And when your skin is acting like it did years ago, it's going to be less likely to have some of the same issues you have today. Yeah. So we're going to unpack this a bit. I'm going to not get too technical. Your genes are made of DNA, and some of your genes are expressive genes. Now, what they do is they express out an information sheet, a blueprint. It's the only thing your body looks at. You won't grow hair, you won't talk, you won't blink, you won't be able to ever repair anything. You'll be a puddle of goo on the floor if you don't have the information sheet. Okay. And that information sheet, when you're born, is perfect. Your epigenome is just absolutely pristine. Now you're exposed to all the same things that adults are exposed to, but you're in an anabolic state and you're growing and you're changing and developing every moment. And your body has kind of a workaround. So kids, they repair faster, they grow faster, they deal with illness, everything much better because everything is just working like clockwork. Yeah. But everything you ever do in your entire life is programmed into your DNA. Every single thing you've ever done, every toxin. I always say if you ate crayons in kindergarten, it's in your DNA. So when you hit the age of 20 and you're no longer in an anabolic state, you're in a catabolic state, so you're fully cooked. Yeah. At that point, I like to use the analogy, when you open your laptop and all of a sudden it's not reading the instructions the same way. They're corrupt. We may not know why it happened or how it happened or why it happened right then, but it's not having that same performance. Yeah. So all of a sudden your body recognizes all of these corrupt instructions, these compromised instructions. And so it begins to not repair the same way. It's very slow at first. But the more that you have to repair something, the more that you have to repeat something, each time it's not going to be as good as it was last time. So all these instructions are compromised. That's what we see as the aging process. Whether it's externally or internally, that's the aging process. Now, this is where a retinoid is so critical, and not just any retinoid, the right retinoid.
Yes.
Because there's certain esters of retinoid and things like that they're not the same. So, and we're not talking about drugstore, department store. So we're talking about what we work with with somebody like Amanda.
Yeah.
The right retinoid, and this is a medical fact, corrects instructions coming from your DNA. You could take two twin girls, identical DNA, put them on the same skincare program. One gets a retinoid, one doesn't. In 10 years, one will look 10 or 20 years younger than her sister in every parameter, discoloration, everything.
That's amazing.
So retinoids change gene expression, and you actually have retinoid receptor sites in your skin, alpha, beta, gamma. And so it connects with those receptor sites. And the results can really be extraordinary. And again, it's a gold standard also for acne and for discoloration and rosacea. So you can address a lot of these other kinds of issues at the same time.
That's amazing.
So it's going to be the skincare management system, and it's going to be Luminate facial lotion. Okay?
Yes, 100%. Also, the difference too, you don't have to cycle off of Luminate. And I have a lot of clients that come in and they tell me like, oh, my derm told me that I need to take a break from my hydroquinone for a little while. But you need to protect yourself all year long. So it just seems crazy to have to come off of something to come back on it and cycle off of it like that.
So I can't change your genetics. I may have said that before. So you've got to do something every single day. Hydroquinone is a phenolic compound. It's a prescription. And I've had doctors say to me for years, Jan, if you could come up with something better, we would work with that. Well, we do have something better. Yeah. And so our physicians recommend Luminate, but the hydroquinone is paradoxical. And what that means is it not only can downregulate active tyrosinase, so it can lighten, it also has a side effect, which is why many countries do not allow it, which is a type of blue-black pigment that develops typically in higher percentages, but when people use it persistently over time, it can happen in lower percentages. And I have a celebrity doc in San Diego who hates to prescribe it because it makes the skin, her Asian patients or her Hispanic patients, look their skin kind of grayish looking. So, it has side effects, and because it's a drug, it's a prescription drug, the FDA has actually said that it shouldn't be used for longer than 90 days. Now, that's an interesting admonition because it takes about 90 days for it to really work, and then you got to cycle off of it. So again, this is something that you can use persistently every single day. And by the way, one thing I want to mention about the right retinoid, I think I left this out, that your dermis is supposed to be 80% collagen. It thins as you get older, so you want this to be thin, but you want your dermis to be thick. Glycolic thickens it about 33%. The right retinoid will thicken it up. This is medical studies, about 50%. A recent study said 1 year of continued use as much as 90%.
Amazing.
Not only that, if you're using your retinoid every single day, which you should, and so assuming that you used it 24 hours before you went out in the sun, it completely stops oxidative damage.
It's like a no-brainer.
So there's no such thing as sun sensitivity with a retinoid.
Yeah, that's amazing. I always tell my clients that too, because I remember, I think it was you actually that I had listened to one of the podcasts or something, and oh my goodness, I'm gonna cough for the rest of my life, about someone going in the sun and using a retinoid, and then the person who got a sunburn but was on a retinoid rebounded quicker than someone who was.
So there's a lot of studies on this, but one of the studies is that if you it wasn't a person, but if you took skin
Oh,
that was
okay.
highly retinized and you burned it in a study, a medical study, or you took skin that was not highly retinized and you burned it, the retinized skin will heal faster and heal with much less damage. So less damage to your DNA. And I noticed that there's a, by the way, sun sensitivity, guys, is a whole different thing. It has to do with a
Yeah.
chemical reaction with UV light that happens with things like antibiotics, doxycycline, tetracycline, zithromycin, et cetera, where they have warnings. It's a much more complex issue, and it doesn't happen with retinoids. Okay, somebody says, I have always been prone to discoloration. If I had pigmentation that really popped up during pregnancy, what is the best course of action? Peels. So we talked about the best course of action. You can also do peels. Peels will help to maybe help this faster, to get to your endpoint faster. So you can do peels. Certain types of peels, it has to be the right type of peel. We do make peels for that type of thing. Let's see. Somebody says, yes, you want to prime the skin before lasers. Absolutely. Will this live be saved? Yep. As far as I know.
I'll save it for sure.
So, okay. So guys, again,
Okay.
ask all kinds of questions.
So what would the difference between melasma and cloasma be?
One is when you're pregnant, one is when you're not pregnant. Basically the same thing, and sometimes they use them interchangeably. It gets confusing. And even men get melasma. They can.
Yeah. Okay. And then also I have another one. What about hypopigmentation? I'm saying it with an
Well,
X.
I sure wish we could address that. So hypopigmentation is where the pigment cells have been pretty much deactivated or destroyed. Let's say, for example, you get a burn on your arm, and when it heals, you have a white spot. The pigment cells are gone. Also, there are autoimmune diseases, being like vitiligo,
Yeah.
in which the body attacks your pigment cells. And vitiligo can be just small areas. Like maybe you'll see somebody with a big white spot on the back of their hand, and it's where that they have vitiligo. Other times it can take over a lot. For
Yeah.
example, there is a model, her name is Winnie. She's beautiful, but Winnie she's mostly has vitiligo everywhere.
Okay.
And there is something that people can do for that, particularly if it's non-segmental vitiligo, as it's called. There's something that they take, which is an immunomodulator, which regulates the immune system so it stops attacking. So there's some newer technologies that can be used in that. And in some cases, if there's far more of the white part of the skin, the depigmented part of the skin, than there is a darker skin, then sometimes they'll give the patient a choice. Well, we can get rid of the rest of the pigment, but then of course you're very pale. But for some people that may be a viable option.
Yeah.
But this is not going to help that, because you need something that stimulates pigment cells, and we're not stimulating pigment cells. We're down regulating the active tyrosinase. Now, there's one other thing, that if there's a small area, and that is that there are certain lasers which actually stimulate pigment.
Okay.
It usually takes several treatments, and it's not permanent. So it stimulates the pigment, and then you may have to keep that up, you may have to do it a couple times a year.
Oh, wow. Very interesting. Okay. All right. What about the discoloration left over from acne?
Okay, that's something different also. So that's known as post-inflammatory hyperpigmentation. So here's what happens. So in the follicle, when you have the C. acne bacteria and oil, and it gets trapped in there, and C. acne bacteria, guys, is harmless. You're going to produce it no matter what. It's a matter of what happens when it's in the follicle. So you can't just get rid of it 100%. Forever. So what happens is the C. acne bacteria eats the oil. It secretes a fatty acid byproduct, which causes your follicle walls to either leak, rupture, or blow out. So that's when you're going to get an acne lesion. So material comes outside the follicle, and as it makes its way to the surface, it's very inflammatory, and it just disturbs little blood vessels along the way, and they get leaky. So what are they doing? They're leaking out bilirubin, verdirubin, it's the color in blood. Now, if you've got fair skin, that means you're probably going to get, when the lesion dissipates, when it starts to go away, you're going to get left with a red spot. It usually goes away pretty quick. But if you've got more pigment in your skin, you're going to have a purplish or brownish or even blackish discoloration.
Yeah.
It hangs around. Now, what we want to do is we want to get complete total clearing. We have to interrupt these things in the follicle. That's done with duality. And so when you manage your acne, there's no cure, but you manage it, you don't break out. I'm a 2-time Accutane failure. Never break out. You'll never see acne on my face, but if I didn't do what I do every single night, I would break out.
Consistency.
So when you do duality and you don't break out, then you're not going to have to worry about the discoloration, but there's also something in duality that gets rid of discoloration about 300 times faster. There's other things we do to get rid of that discoloration much more rapidly.
Yeah.
Okay? So that's, again, a whole different issue. And somebody said, what about hypopigmentation spots on arms and chest, more on a yeast or fungus diagnosis? You need to go to a derm. There's something that you can be given for that. You can sometimes get little, I think it's called PK, but it's little spots that can be all over, and it's actually not hypopigmentation. It's not about the pigment cells. It has to do with, like, this, again, this little fungus or yeast kind of condition, and you can get that easily treated. What do you recommend PRP underneath the eyes? It depends on what it is you're trying to address. If you're trying to address dark circles, I've seen where it can be very helpful, and other times I've seen where it's less helpful. If you're talking about a distortion under the eye, so here's what happens. Your eyes are on a fat pad all the way around. Underneath the eye, that fat pad is held in place by skin and a membrane, collagen, so it acts like Spanx. So you have a nice contour. As your Spanx, so to speak, kind of give out, then that fat starts to herniate. And that's when we look like, gee, our eyes are a little swollen, because fat also retains water. It can retain as much as about 80%.
Oh, wow.
Whereas your body, you have about 62% in your body, give or take. So that's when you wake up in the morning and it can look like your eyes are really puffy, and then it kind of gets better during the day. But sometimes as time goes on, it doesn't get better. Fat can also separate, and you can get a Trow defect, which is indentation. It can also separate in a way in which it gets distorted. PRP doesn't really help with that at all. So if, again, dark circles, maybe some helping with a little texture around the eye area, that's one thing. If you really need to address that fat herniation, then here's options. Option number one is where they make an incision on the inside of the eye. Now, this sounds really awful, but it's not. The person is wearing an eye shield. They make a laser incision. It's literally a bloodless incision. And what they do is they remove the fat. It looks like a little tiny bunch of grapes almost. They remove that fat. And then there's no stitches. There's virtually no bruising. So if you don't have a lot of fat distortion, it's just distortion, but it's just herniated fat, it can be amazing. And also it tightens up because it takes more skin to cover it when it's more concave than when the fat is herniating out. Now, if it's the distortion or you have a lot of excess skin, then they're going to have to make an incision along the lash line. And what they do is they go in and they may remove some fat, but oftentimes what they do is they rotate the fat, because the distance between here and here should be short. It shouldn't be like all of a sudden it's like hollowed out. And so it's much more youthful if you look at individuals who have not had this happen yet. Again, the distance is short. So it depends on your anatomy. It depends on how they need to address that. And when they make that incision, I've never seen a scar that you could notice, and it heals very rapidly. It usually heals really, really well. So those are kind of the options. Now, you have to really understand what to do, because you could spend a lot of money. You can spend thousands of dollars on PRP going in and having 3 or 4 sessions. You could spend as much, sometimes as more than you would spend on having the eye
Yeah.
addressed, that eye area addressed with a surgical option. So you really need to understand what you should do, talking with an ophthalmic plastic surgeon. Okay, so that would be an ophthalmologist that does surgery, or a board certified plastic surgeon. And some of those guys do PRP, so they can differentiate between what you would benefit from and what you might not benefit from. Okay, let's see. Here's a question. What product should I use for the dark acne scars left from acne? We talked about that. It's a skincare management system in its duality, because you want to prevent future acne lesions. You want to make these disappear a lot faster. Duality has something that they go away about 300 times faster. And there's other things we use along with that, peel pads and things like that,
Yeah.
that can really speed the process up. I'm 26 and have hollowing underneath the eyes, and wondering if that would help with that. And when we say that, if she's talking about PRP, typically that's because the fat has dropped down lower. Again, you would want to rotate it through some type of a surgical procedure. It may or may not help, but again, if you really want to address it, and if you're willing to spend thousands of dollars for a very minimal result that may not make you happy, or you go in and have the surgery done, which is, it's going to last you the rest of your life, then you just have to figure out and talk to somebody that can really go through the options with you. Okay. You are so beautiful. Thank you. I will do anything you say for skin like yours. Oh God, that's so kind. Let me tell you how much that means to me, because I have a birthday coming up in December. I'm going to be 73. So I really, really appreciate the compliment, and I work at it. You know, it doesn't, anything that has to do with your skin, it's like anything else. You know, you have to work at it. Okay.
All right, I have some more questions still, and you look amazing. So I agree.
Thank you so much. Thank you. It's really kind.
So how do genetics and ethnicity play a role when a person is developing their discoloration?
Okay. So, your ethnicity plays a role in your pigment cells before the active tyrosinase, you know, when they're on the path to come to the surface. Your pigment cells are, there's a word for it, they're packaged. It's kind of like they're in little sacks. So you have red yellow pigment, you have blue black pigment, and we have some of each. And sometimes we have more blue black, or brown black, I should say, not blue black, but brown black, and sometimes we have more yellow red. Now, when you have darker pigment, they're more loosely packaged, and when you have lighter pigment, the more red yellow, it's tighter packaged. So the looser packaged melanocytes tend to be more reactive to active tyrosinase or other kinds of things. So they tend to sometimes come to the surface in a more reactive manner. Maybe it's not as even, but they're more reactive to the sun and active tyrosinase and all those kinds of things. So that's, again, a very complex subject, and I'm oversimplifying it.
Okay, so can medications cause, or medications or topical products cause discoloration?
Okay. So, for example, when you take tetracycline or doxycycline, or, you know, all those different antibiotics, there's a warning on there, and it says that you might have sun sensitivity. So what that means is that antibiotic makes you reactive to UV light, to the point where you could be wearing the best sunscreen in the world and you will burn to a crisp. I had it happen to me years ago. I ended up in the emergency room.
Oh,
Didn't matter that I was wearing it. It's just inflames. It's bad. So those kinds of things could certainly exacerbate.
yeah.
And I'm gonna tell you a few other things that people don't think of. So let's just say you're wearing a beautiful, expensive perfume. Some expensive perfumes have bergamot oil in them.
Yeah.
Now, Estee Lauder, when she was alive, she used to say, the way you wear perfume is you don't just spray it on you. You spray it in the air and you walk into it.
Yeah.
Kind of coats you, right? Well, here's the problem with that, is that it's getting on your chest area, exposed areas. And bergamot can be sun sensitizing for pigmentation. The other thing, you're sitting out at the pool and hopefully you're wearing your sunscreen and a big hat. But anyway, you're drinking a lemon lime drink and the
Yeah.
bubbles are hitting you in the face. Lemon lime can be sun sensitizing.
That
So things like
margarita.
that we don't think about. And there are certain diseases like I'm trying to think. I think one is Addison's disease, which has to do with cortisone. President when President Kennedy was alive, he had Addison's disease. But I also had a case study that had Addison's disease. She had a very bronze effect to her skin that wasn't from tanning, so
Oh,
it made
wow.
it look much. It made it look darker, sometimes kind of uneven, and we were able to manage that somewhat. But it's difficult when it's because of a drug, and
Yeah.
of course, birth control pills, and pregnancy hormones can also play a role in that.
Yes, I always have. I mean, I've been getting a lot of pregnant clients lately, and a lot of them end up with some pregnancy melasma or cloasma. um, okay, so this is such an important one because this is one that I stress to my clients. I swear they hate me because it's all I preach, but sunscreens, how do those prevent discoloration?
Okay, so I'm going to answer a question here really quick
Oh,
because it
sure.
says, where can we go find and read your case studies? Well, first of all, if you're a professional, we have a professional section of our corporate website, which gets into a lot of that and even podcasts and things with doctors, interviews, and a lot of before and after pictures. And there's before and after pictures on just the regular section of our website. And I'm sure Amanda has our before and after pictures as well. The other thing is that I also have a YouTube channel, and um, um, consultations by Jan Marini. I can't remember what it's called, but the YouTube channel was before COVID. I was doing tons of consultations, which I actually put on there with real live individuals, and then there's a lot of other information on there. So you can certainly go to the YouTube channel. And again, working with Amanda, you can get all of this information. But anyway, I'm sorry, Amanda, you asked me.
Oh,
The
no, you're
question was sunscreen. How does it present discoloration? Okay, so first of all, sunscreen, if you're using a chemical sunscreen, what it does is it captures the rays and it kind of disables them. Okay. And then if you're wearing a physical sunscreen, it kind of reflects rays away. And for years and years, we've heard physicians, we've heard a lot of individuals say, well, the best thing and the most protective thing is a physical sunscreen. I do not believe that is true. And I'll tell you why, because there's a lot of factors that go into this. Now, I'm going to, again, oversimplify this. When we're protecting the skin, we're measure the way that the light enters the skin by nanometers. And there's a spectrum of visible light, because about 50% of the light that's out there, we don't even see it. We don't even know it's there. So
yeah.
it goes from 0 to 320 nanometers. To 0 to I'm sorry, it goes from 0 to 400 nanometers, excuse me. 0
Okay.
to 320 nanometers is UVA. And
Okay.
then from there on is UVB. UVA is the burning rays, and it's the rays that are the strongest in the summertime when we're closest to the sun. People use that to tan with, but they get sunburns and all that. And then the UVA rays, which are the other part of the spectrum, they're the same intensity all year round.
Yes.
Okay? If there is any sun outside, just because it's dark outside and it's snowing, the sun is in the sky, you're getting the same amount of UVA as you are at 12 noon in August. It goes through the windshield of your car. It'll go through light clothing. It goes into your windows of your house. Okay? And it penetrates like an x-ray and it sets up a cascading effect, which is really horrible for your skin.
Yeah.
A lot of the deeper skin cancers and a lot of other discoloration, a lot of other things, the deeper aging changes are a result of this. So number one, you have to wear sunscreen all year round. Sunscreen is an FDA over-the-counter drug. So you don't need a prescription, but it's still considered an over-the-counter drug. So what we say about it, There's a box on the back, a facts box. Everything that's in that facts box is regulated by the FDA. We are not allowed to make a claim on the label for UVA. When you see SPF 30, SPF 50, SPF whatever, that is only, in the US, it's only UVB. Other countries, some of them have a UVA rating and a UVB rating. So
Okay.
the only way that you're going to know that it's going to protect you in the UVA range is if it says broad spectrum.
Yes.
Broad spectrum legally means it goes over 320. What if it only goes to 321? So between 321 and 400, you don't have any protection.
That's a big
You're just
gap.
absorbing in all that light. So the first thing you need to know is that our sunscreens go to 400.
Amazing.
Sunscreens, though, will drop back down. That's why you have to reapply them when you're outdoors. Okay. And so they can drop down a bit, but ours goes to the end of the spectrum. Now, so that's really important. And the difference between, I want everybody to wear a minimum of a 30, because otherwise you don't put enough on.
Agree.
But the difference between a 30 and a 50 or a 60 or a 75 is minuscule.
Yeah.
It doesn't do you any good. So that's number one. Number two is the difference between the chemical and the physical. So a lot of you, we've heard physicals are supposedly better, and I'm going to dispute that. So there was a study that was done that took an SPF, I believe it was SPF 15, that was made with zinc oxide, which is your physical block. SPF 15 that was made by with Parsol 1789, which is albendazole, which happens to be my favorite. So the SPF that was the physical in terms of immune function protection. Now, immune function protection is a different measurement than did I burn, didn't I burn? It has to do with how does it protect your body when it absorbs in, and what kinds of things does it put in place to help you to prevent the damage. So in terms of immune function protection, the physical with zinc oxide was the equivalent to about an SPF 4.
That's
the
great.
sunscreen with the Parsol 1789 albendazole, which is what we use, actually tripled to a 45.
Oh, wow.
So there are other things you can do also to mitigate sun exposure, because you can wear the best sunscreen in the world and you'll absorb in 3% radiation still. That's a lot.
Yeah.
And that is that we use phytomelanin, which is chemically identical to human melanin. It comes from the date palm. It's colorless. It's very protective, and there's a lot of other things that are coming out about melanin that show that it's anti-aging. It also sets up the skin's circadian rhythm, so there's really good things. We also have in there something called beta-glucan 1,3, which attaches to Langerhans cells. They look like little pigtails that go to the surface of your skin. And what they do is they're like little warriors, soldiers that are out there looking around saying, oh my God, what is she coming in contact with that we can make sure that it doesn't have something negative happen.
Yeah.
Well, your Langerhans cells, when they're exposed to radiation, they kind of get out of commission. They become compromised temporarily, but sometimes for a substantial period of time. And so you don't have the same protection. This attaches and helps to keep them from being compromised. So there's a lot of things in there besides just we talked about the oil capture system, all those things that are really phenomenal that make people want to use sunscreen.
Yes. And sunscreen, I feel like, has just come a long way as far as like texture, feel, all of it. So there's really no excuse not to find the perfect sunscreen, which you guys have, and wear it every day, all day.
Well, I know that we're going to run out of time, but I want to answer one last question here. It says, how often do you use the peel pads? Okay, so we have two different types of peel pads. They're in a jar, 30 of them. They're soaked with pre-soaked. So what you do is, depends on what you're trying to address. This is where Amanda comes in. She can advise you what you're using them for, but it can be as much as 2 to 3 times a week, or it might be just once a week. You can leave them on for as much as 10 minutes, but depending on the type of weather, there's times I've left them on for as little as a minute. So what you do is you're going to clean your skin, you're going to towel dry, wipe it over your face, leave it on, and then you rinse it off, and you still use all of your other normal products.
Yeah.
Okay? That's all there is to it. It's really simple.
Yeah, and my skin always feels so good and just like glass. Like I feel like it looks like glass after.
Mm-hmm.
I love it.
And it
We
really
love
helps with the
that.
discoloration, brown discoloration. It helps with discoloration from acne, acne scarring, pore size, fine lines, wrinkles, all of those kinds of things. So it's a great adjunctive product for everyone.
It sure is. Well, Jan, thank you so much for
You're so
taking the time to
welcome.
answer all these questions about discoloration. Sorry I had a coughing fit in the middle of this.
Again, it's happened to me. And so I totally understand. And it's been such a pleasure. And thanks, everybody. Thank you so much for your questions. And thank
Yes,
you for watching, because I wouldn't be here without you. And it's been a real pleasure.
thank you so much and enjoy your Thanksgiving. And if
I
we don't
will.
talk to you before your
Thank you,
birthday,
everybody. Happy
have a great
holidays.
birthday.
Yeah.
Thanks.
Till next
All
time.
right. Yes, till next time. Thank you so much.
Uh-huh.
All right, take care.
Bye.
Bye.